Ladies and gentlemen, our next session is a panel discussion entitled The Cancer Control Program of Asian Countries, Learning from Experiences and Best Practices. Our first panel speaker is Professor Sohartati Gondowarjo, a senior consultant at the Department of Radiotherapy at Cipto Mangunkusumo National General Hospital in Jakarta, Indonesia. She is the chairperson of the National Cancer Control Committee, president of the Federation of Asian Organizations for Radiation Oncology, president of the Indonesian Radiation Oncology Society, and national project coordinator for several IAEA projects. Our second panel speaker is Professor Ekapop Sirachanan, AOS board member and president of the Thai Society of Clinical Oncology. He is an associate professor at the Oncology Unit of the Department of Medicine in Mahidol University and the chair of Ramatibodi Comprehensive Cancer Center. Our third panel speaker is Professor Sanjeev Misra, AOS counselor and director and CEO of All India Institute of Medical Sciences in Jodhpur, India. He is a professor of surgical oncology at King George University, sectional editor in oncology of the Indian Journal of Surgery, associate editor of Indian Journal of Surgical Oncology, president of the Indian Association of Surgical Oncology, a founder member of Indian Breast Group and Indian Liver Group, and member of the Board of Trustees of the Jodhpur Initiative. Our fourth panel speaker is Dr. Tung Buiduk, AOS counselor and supervisor of the Ho Chi Minh City Cancer Registry. He is a surgeon at the Department of Breast Cancer at Ho Chi Minh City Cancer Hospital, voting member of the International Association of Cancer Registries, and member of the Association of UICC Fellows. Our last panel speaker is Professor Dong Yung No, AOS Advisory Board member and past president of APFO-CC and APCC. He is the chief of the Breast Care Center and Laboratory of Breast Cancer Biology in Cancer Research Institute at Seoul National University. Also the principal investigator of the Minister for Health, Welfare and Family Affairs funded Translational Research Organization in Cancer Project. Ladies and gentlemen, please welcome our distinguished panel speakers, Professors Sohartati Gondowarjo, Ekapop Sirachanan, Sanjeev Misra, Tung Buiduk, and Dong Yung No.
Good afternoon, everybody.
Good afternoon, everyone. Good afternoon. Good afternoon, everyone. Okay, so let's proceed to the Q&A portion. For all speakers, here's a question from our audience. Based on your experience and expertise, what do you think Asian countries should prioritize for cancer control, and any programs to help other Asian countries to achieve a common goal? Yeah, so that's for all our speakers.
Yeah. Can I first?
Yes, Professor Sohartati. Thank you.
Yeah. For me, the most important thing is to run the cancer registry, since without a good cancer registry, we cannot make a good planning. And the second is to make a standardization of the treatment guidelines. So anywhere the patient are treated, they will get the same treatment procedures. And the third can be also how to increase the cancer awareness within population. I mean, within the population within the countries to do the primary and secondary um, uh, preventive things. So that's the third most important factor to do priority within the Asian countries. Thank you.
Okay. Who else?
So, for me, for my opinion, I think that we should focus on the common cancer that's very unique in our area, such like cholangiocarcinoma that's very common in Thailand, Laos, and Cambodia. So we lack a lot of knowledge about the disease, like pathogenesis and how to screen the disease, how to treat effectively. So we need a lot of research, collaboration between Asian area so that we can solve that problem.
Thank you.
Can I also add to that? I think the cancer control program will have to be different for each Asian country depending on the common cancers that they have. If you look at the example of India where it's tobacco-related cancer, how are you going to diagnose them early, what screening program, what primary prevention? But for that, I think what we can learn from each other is, for example, Japan and Korea are doing very active screening program for stomach cancer. And we can learn from them how to detect early because there are each country the cancer scenarios are changing. In certain places they are becoming more, which is pertaining to Japan and Korea. And there are certain things which are again particular to that particular country. So we can learn from the good practices, especially in the early detection. But when it comes down to, if you talk of vaccines, etc., to prevent, for example, hepatitis D, I think that's where national programs can be very common, where we can all work together. And when we talk of prevention like that.
Thank you, Professor. Okay, so I'll proceed to the next question. This is a personal one for the three of you. During this COVID-19 pandemic, what do you think is the biggest challenge and opportunity in the implementation of a cancer control program in your country? Professor Mitra?
The COVID pandemic as a country, I think we have been doing pretty well because we did implement a lot of measures. But cancer care, yes, did take a hit, and the cancer control program did take a backseat during this time. But then it's also an opportunity right now to use technology when we talk about whether it's talking about cancer prevention, using the simple technologies in terms of tele-consultation and tele-advice, and which can be done very simply with mobiles, etc. And you don't need any fancy equipment to be carrying this out. So this is something which I think as far as the cancer control program, which we can really improvise and work. You don't have to be visiting door to door. You may actually be able to carry out, you can develop apps which can work for this cancer control program. And for cancer care, it's been a challenge. The fear of the patients coming to the hospitals have been there. There was initially fear from the doctors, but for treating them. But then here, what at our institution, half of the hospital was a COVID, and the other half was catering cancer care and all the surgical and medical procedures, including radiation. So I think that has been good.
Thank you, Professor. About Professor Sir China?
Yes, during COVID-19 pandemic, in our country, there's some effect for the patient for screening for cancer, and also for the patient who need to receive treatment for cancer, like adjuvant chemotherapy or palliative chemotherapy. So I think we need to set up a good quality system to control the COVID-19 pandemic in the country, so it will be less effect for the cancer patient prognosis and also for the treatment effectively.
Thank you, Professor. Professor Tati, please.
Yes. Yeah, especially in our country, for example, we are still struggling with the first wave of the COVID-19 pandemic. So it's not yet finished, even just only the first wave is not yet finished. So what we can do, it's a bit difficult to talk about the promotion. Promotion can be done. What we do right now is virtually to increase the awareness of the public and also the medical professionals. But we are not advised the woman to do the screening right now, to go to the primary health care because there are still a lot of COVID-19 cases in the primary health care as well in the special hospital. So, except when since we give them a lot of virtual information, so except when they have a symptom. And for the treatment, anywhere, especially for radiotherapy, radiation oncology, radiotherapy, because I'm a radiation oncologist, all the centers of radiotherapy within the countries are open. And also the cancer treatment is still continuing with some changes in the regulation. For example, we divided the patient in the high risk of cancer, medium, and the low risk of spreading and something like that. And which patient can be postponed, which patient have to be planned, and which patient have to do the treatment directly. So that's what we do right now.
Yeah, so very well said. Thanks very much to all of you for sharing your expertise and your time. So I think that's all for now for our session. And see you around.
Thank you. Bye.
Thank you. Bye.
Thank you.